My Lords, I join the very general and fervent thanks to the Noble Lord Patel and his committee for this terribly important report, and the Noble Lord himself for his introduction to this debate. The Noble Lord mentioned an issue I'd like to start with, which is the situation of our current final year midwifery students. The Royal College of Midwives did a survey and found that 84% of them said they are not confident they are going to find a job after graduating this year. This makes no sense at all. We're currently in the middle of calculating the formula for exactly how many midwives we need, but if we look at figures from the Royal College of Midwives, a survey of members recently found that midwives and maternity support workers were working an estimated 118,000 unpaid hours of overtime each week to meet the needs of their patients. That we should be grabbing these graduating midwives with both hands and making sure they have a secure future, because of course they now face the enormous weight of student debt, many of them being previous graduates who are doing this as a second degree, and there's a risk they'll go and do something else because they need to put food on the table, keep a roof over their head. And of course this is a situation that we're seeing many resident doctors, resident anaesthetiologists already facing. As the Noble Lady the Minister will know, I've been putting written questions down on that issue. But coming specifically to the issue of preterm births, I'm going to focus not on the care but on the public health issues here. And we've heard a great deal from many expert figures in this debate about that we don't know in many cases what the cause of the preterm delivery is. But one of the things we do know is that poverty, inequality and discrimination increases the level of preterm births, increases the suffering. And the most recent figures show that neonatal mortality rates, associated of course with preterm birth, from the most deprived areas have just increased for the third year in a row. We are going backwards. And in terms of preterm birth and neonatal mortality, the data is not nearly good enough, but it's clear that minoritised communities are suffering a double disadvantage, an intersectional disadvantage. Let's make a statement of the obvious. Reducing deprivation, reducing poverty would reduce preterm birth. I don't believe there's anyone would disagree with that statement. And I particularly, drawing on the Bliss briefing, asked the Noble Lady the Minister in terms of the government's response to recommendation 1 of the committee. What future metrics, what targets, what ambitions is the government making progress in that area? But most of my speech is going to be addressing an issue that no Noble Lord has yet addressed, or I suspect will address. I'm going to focus on the One Health, the environmental health aspects contributing undoubtedly to preterm birth, even if we don't actually understand the precise details. We know that our environment is in a terrible state, and those who are pregnant are particularly vulnerable to that disastrous environment. We have a planet which has been choked in plastics, soaked in pesticides. We've seen drugs ending up out in the environment, creating antimicrobial resistance, creating other deleterious medical effects. And I'm going to start with what I think I have to say is a deeply shocking study which came out after the committee reported. And it's only one study, but it is seriously indicative. This is a study that was presented to the Society for Maternal Fetal Health Medicine's annual meeting early this year, the pregnancy meeting. It was investigators at the University of New Mexico who analysed 175 placenta, 100 that were deliveries at term and 75 that were preterm. And the level of microplastics and nanoplastics in those placenta was significantly higher with the preterm births, and they were much higher than previous levels of microplastics and nanoplastics that have been measured in human blood. So it's very clear that the placenta is concentrating microplastics and nanoplastics that's in the maternal blood. But what is deeply concerning is that the preterm births have higher rates than do the full-term births, which is counterintuitive, because if this was a gradual accumulation over a time that was unassociated with the preterm birth, you would expect the longer-term ones to have more plastic. So this is deeply concerning. I come now to PFASs, what are generally known as forever chemicals. And there were 2 studies published in 2023 that showed an association between the level of PFAS in maternal blood and the rate of preterm birth. And one, I'm going to refer to the study in environmental health, Siwati et al., that showed that it was particularly affecting male babies, and the accumulation in male babies was higher than female babies. Now, the noble lords here, our experts, will tell us that male babies are more fragile at birth, and PFAS is concentrating more in those babies, with potential effects we don't yet understand but are deeply concerning. Another study from the University of Emory found that mothers with higher levels of PFAS in pregnancy are 1.5 times more likely to have a baby born 3 weeks before their due date or earlier, the preterm babies we're talking about, and the early term, 1 to 2 weeks before, is also raised. We know also that we have pesticides all around our environment, and a recent study again in environmental research showed that glyphosate, the chemical to which we are all very heavily exposed, the chemical to which noble lords might have recently seen, there was a study showing extraordinarily high levels of glyphosate in tampons. Glyphosate is associated maternal blood levels with higher levels of preterm birth. More broadly, pesticide exposure. Another study that showed that there is a meta-analysis. A lot of this is uncertain, all of this is very complicated, but a meta-analysis suggested some of the ways in which pesticides might be having impacts on preterm birth. So it might be triggering inflammation and oxidative stress and disrupting endocrine functions. And finally, the microbiome. Noble Lord Winston mentioned the issue, our starting to understand that the vaginal microbiome is significant in terms of the preterm birth, many other aspects of health. Well, a study again from 2023 showed, again this is one study, but there was a unique genetic profile in the microbiome of preterm births. There was a higher richness, a diversity of microbes, and there was also a greater diversity of antimicrobial resistance genes. So we have here a real problem with the vaginal microbiome and issues that we don't yet have much understanding of. But here, unfortunately, Noble Lord Lang's not currently in his place, but I cross-reference here the debate the Noble Lord and I had, and indeed an amendment this House voted on, about regulating period products. Because one of the issues that I was raising in the context of period products is reusable period products that have high levels of silver and nanosilver, which demonstrably have negative effects on the vaginal microbiome. Plus, of course, there's the tampons I was talking about earlier, the pesticides, but also evidence of heavy metals, which are going to have impacts on the vaginal microbiome. So, all of these issues, and I apologise, my lords, this has been a rather depressing speech, but this situation is not inevitable. We have a situation where companies are making products that are threatening the health of all of us very broadly, but particularly threatening the health of the most vulnerable in our society, those who are pregnant and the young babies that are going to be born into our society prematurely. This is an area where we need urgent government action. Now, I've cited very recent studies, and the reaction, the knee-jerk reaction to the government from the civil service in all of these kind of issues tends to be, we've got to wait for more data, we've got to wait for more information. But actually, my lords, just look at the list of things that I've gone through, and each one of those were cases where researchers were looking at one product, one factor in isolation. But no pregnant person is exposed to just one of these factors. Everyone is being exposed to all of these as a cocktail, and this cocktail is going up. The level of it, the level of all of them, is going up all of the time. And once we've put them out into the environment, effectively we're unable to take them out. Surely, on preterm birth, on the state of our health of the nation, we need to apply the precautionary principle and take urgent action to rein in the corporates who are exposing us to all of these threats.